Hi, friends. I'm Dr. Molly Brinkman. I'm a veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably obsessed with your pet already, and I want you to understand more about both of those things. So welcome to the Dr. Molly Says podcast. And I'm in a bed.
Yeah, we're giggly squatting it up right now.
We're giggly squatting. And I'm with my friend who most of you know. This is Dr. Nicole Fine.
Hello, hello.
Hello.
Yay.
And tell them where we are.
We are in a really non-fancy hotel room in Orlando, Florida.
We're at the Hilton.
Yes. Where are we? Global Pet Expo.
Global Pet Expo. And I bet a lot of people listening have no idea what Global Pet Expo is. We should tell them.
We should tell them. So it's a convention, but it's much more like pet product focused rather than pharmaceuticals and sort of vet med specific, which is fantastic because there's toys and treats and doggies everywhere with booties and sunglasses, and it has been a blast.
It's like all the pet products you could ever think of, ever. I guess the attendees are like buyers, right? Mostly, that's who's here.
I think so. And a lot of dog and cats that are famous on Instagram. They're like celebrities walking around. Their leashes have their Instagram handles, and they're
here
stopped for photos. It's really fantastic.
Yeah. So people like us are in heaven.
Oh yeah, fangirling for sure.
Very, very fun. And we get to see all the like latest, greatest products and all of that. So that's what we're doing. And we've been wanting to record a podcast. And I'm like, let's do it. And we were like, there's not a good setup in here. So we just decided, let's just record from the bed. So.
In matching pajamas.
These are print fresh pajamas.
And the print is called
Must Love Dogs.
Right? I mean.
And we love it. There's all kinds of dogs.
There's French bulldogs on here,
there's
so I'm
Frenchie,
sold.
There's a standard poodle. There's a corgi. There have been so many corgis here.
So many.
It's very random, but I mean, I love a corgi. There's a dachshund. Anyway.
Little greyhound action.
They're very comfy too. We got matching PJs, so highly recommend Print Fresh. Our friend Ashley is obsessed with them. So that's what we're doing. Hello. So if you don't know Dr. Nicole Fine, or if you have seen her on the internet, she is a veterinarian. She's a boarded internal medicine specialist, which we're going to talk a lot about. She lives, well, you tell us, where do you live?
I live in Huntington Beach, California, which is fantastic.
A very ugly place.
It's terrible, the worst.
And tell us where you're from.
From Miami originally. I've been in California like 6 years now and went to vet school in Minnesota. Don't you know?
Minnesota.
Oh, yeah.
And when did you graduate vet school?
2017.
Okay.
So it's been a minute.
And then you've been boarded since
2021.
Okay. And you're like doing a lot of different things. She's making content on the internet.
Yes.
And she is an internist. So we're going to talk about it. And works in the ER. So lots of different things that you get to do and see in vet med. Okay, so we are good friends. So we were like, what do we want to talk about? We also need to just like hang out. So hang out with us. I ask everyone on the show about a hot take. Do you have a hot take? We usually say hot takes over hot tea, but
I have many, I'm sure. In my world, I think my hot take might be more diagnostics are not always better.
You heard it here first, folks, from an internist.
I
actually love this.
Yeah. So the phrase I like to say is like the only reason to run a diagnostic test is if it's going to change what we do moving forward. And I think sometimes, especially in cases that are complicated or confusing and we don't know what we're doing, there's sort of the instinct to just throw a bunch of tests at it and see what pops up. But I find that A, costs families a ton of money, and B, gives you a lot of information that sometimes becomes even more complicated to interpret. So I feel like, or even like in a scenario where you say, oh, I'm looking for, say, a mass in the abdomen, but you know you're not going to do surgery. Do you need the CT scan? Because if you're not going to cut it out, and if you want the information, that's valid for sure. But if you're not going to do anything with a $3,000 test, like do we need to run it?
Right. Yeah, like what are we going to do with this information? Well, I have that conversation a lot in GP.
Yeah.
You could go do that, but what are we going to do with that information?
Right. Yeah, we could, but do we need to or should we?
Yeah. Oh, I love this hot take. We're going to get into it more. Okay, I always ask somebody for a hot take. That's a good hot take. It's their steam. Okay, next question. If you were a dog breed, what would it be?
I I feel like my instinct is always to say Frenchie, but I'm not actually like a French bulldog. I just want to just like eat them.
Yeah, you breathe very well, very quietly.
We've been rooming together and I don't snore, so I'm not a French bulldog. Well, I don't, right? Okay.
No, I don't either, do I?
No.
Okay, good.
I think, I don't know, something like that likes to sleep a lot, but is like cute and snuggly. Maybe like a Cavalier or something. Something small, like a little bougie, but not too high maintenance.
You definitely give Cavi vibes.
Right? Okay, great. Yeah.
Actually, I think that's perfect.
Okay, I love it.
You love everybody.
My tail's always
You're
wagging.
Excited to see people. You're chill. Yeah, you're Cavi.
Okay, great. But without heart disease.
No heart disease. Yes. All right. Cavalier. I love that. Cavalier, King Charles, Lapdog. I had a friend when I was a kid, and her mom was British, and she always had Cavaliers. And Cavalier, King Charles, Lapdog is what she called them.
Ooh, fancy. I need an accent.
So yeah, you're a fancy Cavi. Okay, we're going to get right into it. Let's talk about internal medicine.
Yay.
So I have realized a lot of just people in the world do not realize how many specialties there are in veterinary medicine. Mm-hmm. Like I posted that cataract video with Dr. Bergstrom from the iVets, and all these human doctors who do eye surgery have found it and are
flabbergasted.
Yes. Like one of them was like, oh man, I'm a human eye surgeon. Can I not do this for dogs? Like, no. What?
Can you imagine?
But they're like all fascinated. They're like, I didn't know this happened in dogs. I'm like, yeah, we do almost everything in animals.
And then some.
That you do.
Yeah.
So anyway, a lot of people are shocked by this. So yes, there are internists in veterinary medicine. Dr. Nicole is one of them. So why don't you walk us through how one becomes an internal medicine specialist in vet med?
Sure. So after we graduate from vet school, you can go straight into general practice. If you want to specialize, the path is pretty similar for most specialties. It varies a little bit, but in general, typically you do 4 years of vet school, then a 1-year rotating internship, followed by a 3-year residency. Things are getting more and more competitive. Yeah. And so depending on the specialty, sometimes you'll do an intermediate year after internship, which is a specialty internship. So you're still technically an intern, but instead of rotating through the hospital as a whole, you stay in the specialty specifically, and then you do your residency. Most residencies have similar requirements. It varies a little bit, but you have to then pass 2 sets of boards typically. So these giant 8 to 16 hour long exams, like I'm not exaggerating, you're sitting for 2 days, 8-hour sessions each. It's excruciating. And then you have to also be published in a particular journal. So you have to do some kind of research paper. And then if you check off all those boxes, then you get lots of extra letters after your name.
What was your least favorite part?
Oh,
she's like, I'm trying to think of a part I liked.
No, yeah. Studying for boards was pretty brutal for me. So I did my residency during COVID. Usually you take your first set of boards after your second year, and then your third set of boards after, or your second set of boards after third year. I had my first set of boards canceled from COVID. So I had to take them both back to back, which meant in the same amount of study time. So we had 6 weeks off to now study for 2 exams instead of 1. So that was really tough. And I took it like from my office at home. And they had this software where we had to pick up our laptop or whatever webcam you were using and scan the room to make sure that you didn't have like textbooks out and you had someone live watching you take the exam the whole time. And so if you stood up for too long or if your eyes darted away from the screen, they were like, you're going to immediately fail. It was very, very stressful. Yeah, it was like, the world is ending around me and I'm like having to do with COVID. This. Yeah, it was the first time they were proctoring the exam remotely. So they had all these like security measures in place because usually everybody flies to the same city and takes it at the exact same
It would also be really hard to cheat. Like even if you had stuff in front of you, right? Because
I would think so. I'm also like way too much of a goody two-shoes and chicken to even like attempt. Plus, I mean, we're talking about like you had to know 2,000 research papers, each of which was 5 to 15 pages long, and they would pull like one single statistic out of it. They'd be like, based on yada yada, is the percentage 35, 37, or 39%? And like that's from one of the 2,000. I mean, it was literally insane.
That is insane.
So I think that sucked.
Yeah.
Yeah, I would go with that.
Okay. That's fair.
Boards were hard.
But you passed. And here we are.
Somehow.
Where was your residency?
San Diego.
San Diego. Okay.
Mm-hmm.
Okay. That is how one becomes an internal medicine specialist.
Years of torture. No, it was
Did
good.
they go back to normal testing? Do you know?
I don't know the answer to that question, actually.
So did you ever talk to the proctor who was watching you? Was this
so
big brother watching you?
I didn't, like, I never got spoken back to, but I definitely talked into my camera. There was, okay, so my neighbor,
cavalier.
I'm taking the test. It's like noon. My neighbor starts blaring music. We're not allowed to have earbuds of any kind in because they thought it might be like, you know, audio. So I forget what I did. At my desk, I used to do my nails there. I had cotton balls. So I start taking cotton and I'm talking into the camera. I'm like, it's cotton. My neighbor's playing music. I'm putting it in my ear. I can't focus. And so I'm like,
could you see them?
No.
You would just hear them if they talked to you.
No, I don't think they like ever said anything. It just was like a service on the other side and they would like flag it. But I'm like,
see you right now. I wish I was a fly on the wall.
I'm putting cotton in my ears. This is my neighbor's music. I was like, can you hear it? And then the next day, the first round felt like it went so bad. Nobody walks out of that test thinking they passed. And I'm like, I failed for sure. The next morning, my internet wouldn't work. So I'm hysterically sobbing on the phone with Spectrum. I'm like, you don't understand. If you don't fix this in the next 30 minutes, my life is over.
Else?
No, it had to be like an approved
you have to tell them
setting.
where.
Yeah. So
but
I'm having a breakdown. Yeah, they finally got it fixed like 5 minutes before the exam started. And I'm just like reading questions and they're so hard and so off the wall and there's tears streaming down my face. And I just look into my camera and I'm like, I'm really sorry. This is just not a great day for me.
It's Big Brother. You should do a whole show. Big Brother else, test taking.
At least like the guy watching this exam is going to like have a laugh.
Do you think it was the same guy both days or person?
I don't know. I have no idea how it worked, but some poor human on the other side.
You know that they talked
like,
about it.
This poor girl had an absolute mentee bee. She was crashing out. And I'm like, I don't know the answers to any of these questions. I'm just like talking to my webcam.
You know, if it was two different people, if they ever got together,
like,
you know,
you had that girl too.
You were that girl.
I was that girl.
The cotton ball girl.
I'm sorry.
That's
I'm not
funny.
cheating. Please
but
don't
also,
cancel my exam.
Like, I feel stressed for you for something that happened years ago, but that's very stressful.
Yeah, I have PTSD from boards.
I'm acknowledging that was very stressful for me. You're welcome. Okay, so that is how one becomes boarded. So
specifically all of those things happening.
Cotton balls in the ears. So internal medicine doctors in vet med, you can find them in different scenarios. Mm-hmm. So a lot of them are in like universities, so vet schools that have hospitals, or just in vet schools, even if they don't have hospitals, internists can be professors. Mm-hmm. And specialty hospitals, referral centers. Mm-hmm. What am I forgetting?
I also worked mobile for a few years, so that was really fun. So instead of not to people's houses, but I would go to different general practice hospitals that needed advanced procedures or a consult for a case that was sick enough to need me, but not so sick that they needed to go to a specialty and ER hospital. So that was fun. And then there are also specialists that work in consulting for like diagnostic labs. So you can pick up the phone and call the internist at Antec or IDEX or whatever the case may be if you have questions about like interpreting lab work and things like that.
I definitely have done that.
Oh, yeah.
Very nice.
I want to do that.
You should do that.
No, not
you want to call.
Yeah. Sometimes I'm like, can we phone a friend? This is real crazy. Yeah.
Antec, hey.
I need a doctor.
Hey, pal. It's me.
It's me. Can you help?
Okay, so internists can be in a lot of different scenarios. Yeah. And I thought it would be good to just sort of talk about, all right, in a typical day as an internal medicine doctor who's like seeing patients in like a referral hospital, or even when you were mobile going to GP clinics, like what are the cases you see most often, like some typical type of patients?
So I think the types of cases we see kind of fall into two categories. So chronic disease, you're thinking things like chronic diarrhea, weight loss that's been going on for a long time, a chronic cough, nasal discharge, things that you've been in and out with your family vet. You can't get an answer. It's like time to bring out the big guns. Or something that's acutely ill that has like, the dog's vomiting and your family vet does lab work and their liver enzymes are off the chart. So sometimes it's not something that's already had an extensive workup. They're like, you need to go.
Yeah.
So it's kind of like those two categories mostly.
Yeah. I'll say this is above my pay grade.
No.
You need someone smarter than me. That's what I'll say.
Absolutely not.
So I don't work in internal medicine, but I know what I send to internal medicine. So a lot of GI cases. Yes. A lot of chronic. So much GI.
So much diarrhea.
Diarrhea, vomiting. Dr. Edelman, our friend Lauren, who's an internist, she was a resident when I was a student at Tennessee, but we got to work together a little bit. But I just will never forget her talking about like fecal charts, like showing people, like, does your dog's poop look like any of these, like 10 poop pictures?
Mm-hmm. So our bread and butter.
So many poop pictures in your email.
Yes. With no context, just a picture of a sidewalk with the splatter of diarrhea.
Like, here's Max's poop today, but no caption needed. Just here you go. Okay, so lots of GI disease, lots of like immune mediated disease, probably some.
Yeah, really the nice thing about medicine, in human medicine, internal medicine a lot of times functions similar to like family practice. Like you'll go to your internist as your sort of first stop.
Oh yeah, tell us how it's like different from human medicine.
We definitely, so I don't do anything GP. So anytime I have a question about teeth or skin or vaccines or wellness in general, I'm always like, I know nothing about this anymore. My brain has been erased since school about all of that stuff.
Just call me.
Yeah, I'm like, help. You guys know everything about everything. I just know a lot about one specific category. But
it's a big category.
It is. That's why I like medicine, because it's kind of the catch-all. So anything that's weird and nebulous and doesn't really make sense, or when you have multiple body systems involved, that falls into our umbrella, which makes it more exciting and fun because there's nothing redundant about IM ever. So liver disease, renal disease, any like big organ system except for the heart, I guess. Airway disease, so lungs, asthma, bronchitis, those types of things. Immune-mediated blood disorders, infectious disease also fits into the category. So like viral, pneumonia, distemper, like those types of things, tick-borne diseases.
Everything internal.
Yeah. If you tell me about skin, I'm like, Julia. Text her.
Yeah. Not skin, not backs, not
skin,
hearts,
not orthopedic. Eyes. If they're limping, unless you say shifting joint lameness, then I'm like, it's not IMPA. I want nothing to do with it. Yeah.
But that's a lot of things.
It's a lot of things.
But a lot of poop.
So
what's your favorite thing to treat?
I like medicine emergencies, which is kind of why I work mostly ER now. So I like Addisonian dogs, but especially when they're in crisis, because it's like a lot of the things I treat are not curable. I just try to manage them long term and make them as comfortable as possible. But there are some things I can fix,
like an Addisonian.
Yeah, and so they then go on to be treated long term, but they come in dying.
Yeah,
and I can make them way better in like 24 hours, which I don't usually get to do. So I like those cases. I also like immune-mediated disease. Those ones have not as fun outcomes sometimes, but in an emergency setting, it's exciting and fun to help.
Have I ever told you about the puppy with Addison's I diagnosed like early in my career?
I don't think so.
It was like a 5-month-old lab puppy.
Really?
Yes. And he came in
just as a journal's like, never.
Oh, he looked dead. His heart rate was like 25.
You're like,
and I was this baby vet, and I was like,
good job for picking that up.
What is wrong?
That wouldn't be on my differential list immediately.
I thought for sure he had been like poisoned or was like anaphylactic or something. Like I was just like, this puppy's dying. But we like got blood and ran it, and his ratio was
Lights
like
were crazy.
12 or something.
You're like,
and everything was off the chart. And I was just like, can this be Addison's?
Could it be? Yeah.
And so, this was when I worked in like a podunk clinic, but we like bolus fluids and steroids, and he like came back to life, and I shipped him to internal medicine. But I was like, I don't think he's going to live. And then he lived. And so I was like, okay, you're going to the ER.
It's a fun disease in that regard. Yeah.
Yeah. I think have I covered Addison's? I think I did an episode about Addison's.
I know you did Cushing's.
Yeah, we did Addison's.
Yeah.
I should have done it with you because you love it.
I do.
Maybe we should do it again. Okay, that's your favorite. I think if I did it, I would like the exciting things.
I like the exciting things, and I like endocrine, and it sounds silly, but I like all the pathways. You know, that I nerd out on, like, ooh, and then this hormone turns to this, and then it.
Yeah, I have such more appreciation for endocrine now than I did in vet school. I hated my life when I was taking endocrinology.
It's a little too much, but once you settle into it and it starts to gradually over the course of years and years and years kind of make more sense. It didn't make sense. Then you're like, all of that stuff in vet school. I remember sitting in biochem and being like, I'm never going to need this. And then like 6 years later being like,
I wish I had paid more attention to that. I know. That's how I feel about like bacteriology.
Like, this is minutia. I'm not going to need to know this. Oh, you will. It will help.
Yeah. Yeah. Yes. There's a lot of things I wish I'd paid more attention to in school. Okay. And then like day to day in internal medicine, you're talking to a lot of clients. Like it's a lot of client communication, a lot of pet owners. You're like
so much
talking to.
Yes. Well, I think the things that we treat are often really complicated. And a lot of times too, they've already done a ton of work with their vet. And so it's not uncommon for people to come in a little frustrated, a little exhausted, and just like, we're at the wit's end. We can't, why is this not better? And so then if we get an answer or I talk about, okay, these are the 3 things I'm thinking and we're trying to rule out, each of those diseases is a 15-minute conversation. So it's a lot of owner education. And conversation. And I think too, like the only way to be successful is to set people up with appropriate expectations. So having the conversation of, I know you're here, but it's probably realistically going to be a few more weeks to maybe a few more months before I have any concrete
you're going to see me a lot more
answers for you. And it may be that long before your pet feels better. And, you know, making sure that they have realistic expectations so you can actually meet them just takes time to communicate.
Yeah. Lots of client communication, lots of diagnostics, lots of like reading through all of that. And
minutiae. I'm like, give me your blood work from 17 years ago and let me track your.
Yeah. And then you have to go through vet records a lot.
That's so much fun.
That's probably one of your least favorite parts of your job.
Yeah. Well, if they're written well, but like some programs have the way that they sort it is really difficult to keep track of. And it's 150 pages of a PDF and the appointment starts in 15 minutes. And I'm like, trying to get a sense of what has happened. It's a lot.
Yeah. So I've had a lot of pet owners ask me about this. So I was excited to talk about it. Just like when they'll ask me questions, like, I don't know when and how to ask to be referred to a specialist with my dog. Or like, is it time for me to go to a specialist? I don't know what to do. And it's like a whole conversation about, which I want to get into, like GP to specialty axis and how that whole relationship. And I mean, it's a love triangle. So like you have the pet owner.
I like it phrased like that. I've never heard that before.
So you have the pet owner, the GP, and the specialist, which it should be.
Yeah.
And that's not always what happens.
But it could be complicated, like a love triangle sometimes too.
It is
we
often
need to make
complicated.
It more like of a throuple, like a very happy, loving relationship.
That should be a throuple. Wait, that's so good. Yeah. Someone write this down. Mm-hmm. Okay, yes. Stop having a love triangle. It's not a love triangle.
It's a throuple. We're in a relationship, a committed, bonded relationship.
Okay, so let's talk about how we make that a throuple. So wait, let's talk first about why. Okay, wait. First, before we get into the more like controversial, let's talk about when, for pet owners, who most of the people listening are like, what are some kind of guidelines on it might be time to ask about being referred to a specialist?
I think the answer to that question also very much depends on your GP vet, because the spectrum of what vets are comfortable doing, capable of, and I don't even just mean like knowledge-based, but like equipment-wise at their hospital varies significantly. So there are some GP vets who can really get a decent way into the workup before they need to refer. There are others that out of sheer volume, they don't have the bandwidth, because my appointments take 3 to 4 hours. They can't sit with you that long. If they have 20 patients, they have to get in and out during the day. So I think that kind of depends. But basically, I would say if you feel like you're having the same conversation a few times, or you've run through a few treatment options and the clinical signs just really aren't improving. Whenever, oh, my dog is on UTI number 4 in the last 3 months. Why does this keep happening? Is there something we can do? Or if there are any like significant changes on lab work and you want something like an ultrasound or more advanced imaging or diagnostics, I think it's reasonable to even just say, hey, I know that this exists. Do you feel like this is a reasonable thing for me to start considering? Or are we still good here? Or what, talking about what the future steps look like so that somebody knows if that's coming, when it might be.
Yeah. And I think like that's a good point. Asking like, oh, I know that referral is an option. Mm-hmm. Do you think we're there yet?
Yeah.
Rather than I want to be referred to to internal medicine.
Yes, absolutely. Yeah. Because that's not going to leave a good taste in your
and it's like a thing that I mean, and not to like, I definitely, having worked in a lot of GP, I have encountered veterinarians who are very like referral averse, I feel.
Mm-hmm.
Are most of them like a bit older than me? Yes. But I don't know if it's like an older mentality. Like if you refer a patient, it means you failed. Like you couldn't figure it out. And so you have to like send it to someone else. I think some
that
hesitation with
mentality exists. And I think on the opposite side, I see a lot of younger vets who should trust themselves more. They know more than they think. And a lot of times they're like, get it out of here, and I understand the temptation to want to do that also. So I think like, that's why just asking about it. And I feel like if you don't phrase it in a way of like, you're not doing a good enough job, I want to go somewhere else. If it's like, hey, are we at the point where this is a good idea? If your vet isn't super receptive to that, I don't know that that's great, because ideally it really should be kind of a team collaborative approach. Yeah. I also think though, there are vets who have that opinion because of negative experiences after referral. And so that solidifies, they're like, I'm not going to keep sending you my cases if this is how they always go. So like, to play devil's advocate, I do know that happens. And so it's fair. They've come by it honestly, like their aversion to referral for sure.
And sometimes they've had bad experiences with specialists that are in their area and they don't have other options. And so
there's one hospital and you're like, this is it. Where do I go?
Yeah. Which is why it's so important, like that's a throuple from the beginning. But I think that also GP vets and specialists who do practice in the same areas, it's so important that we like create relationships before we have to refer patients. Yeah. Like I know what my local internist does and like what their, what diagnostics do they have, and can we chat about a case I'm going to send them or whatever. And I think that's an important like way to set up that relationship. But at any point, I think it's important for pet owners to know that, if they're not getting somewhere with their pet and they feel like there's something else going on, or they're not really getting better, it's always appropriate to ask like,
I think so too. At the end of the day, you don't know what you don't know. And it's not like GPs don't know enough. It's just, I spent years and years looking at the same thing 100,000 times. I might pick up on a subtlety that's like, oh, I know exactly what this is, that you don't. And it's not a matter of like, it's just training differences. And that's why specialties exist.
Yeah. Well, and also y'all see all the weird things all the time.
Oh yeah, for sure. And I spend hours combing through diagnostics. A lot of times you just don't, that's not what you're set up to do. And so you're kind of being set up for failure if you're trying to manage a case the way that I would, in the same way that I couldn't do what you do.
Yeah.
I'm like, wait, I have to see an appointment every 30. No.
Yeah.
I need 3 hours with this person.
Yeah.
Yeah. So it's just, they're entirely different specialties. In my opinion, general practice is a specialty. And they're just different.
Yeah. It's just different.
It's just different.
And unfortunately, a lot of times GP doctors get stuck with having to be all of the above because people can't afford to refer. Or they
a lot of times they don't trust, like you do such a good job, almost to your own fault. You do such a good job creating trust with your client that they're like, we don't want to leave.
Yeah.
Which is why
we're a couple and they don't want to be a throuple.
I want to let someone in. I love you. I trust you. It can be tricky, and the cost associated is not a insignificant component. So that's also there.
Yeah.
So then you guys are left trying to kind of MacGyver together a plan And 9 times out of 10, I think you do a stellar job at it. So, but
9 times out of 10, maybe like 7 times out of 10.
no.
If it's real complicated, maybe like 7 times out of 10. Yeah. And, there's a lot of talk about GP specialty access right now in the vet world, and like, how can we work better together? How can we make outcomes for our patients better? Do you know about the JAVMA study in 2023?
No.
Okay. So there's I guess it was a survey study of pet owners and GP veterinarians and specialists. So they looked at, I don't know how many were in it, but they looked at all these patients, their people, and outcomes. And basically they concluded that the more collaboration there was between the GP doctor and the specialist, the better like client satisfaction was, and even like patient physical outcomes were better.
That doesn't surprise me, but that's really interesting.
Yeah, me either, because it's like so important for GP vets and specialists that they refer to have somewhat of an open dialogue. Yeah. I know like y'all spend a lot of time on the phone with owners and spend a lot of time seeing patients and reading about patients and all of that. And it's hard to then carve out time to like relay it to the vet too.
It's like time is the limiting factor as far as resources all of the time, especially in our field, but I'm sure that this applies to others. But to your point, like if I take on a few new transfers in the morning, each of those phone calls is 30 to 45 minutes with each owner. I'm then seeing a full day of appointments. ERs are coming in. So like to jump on the phone with the referring vet for another half an hour, like a lot of times that time's not available, and vice versa. So maybe I'll call, but Dr. Brinkman's in surgery right now. She'll be out. Like, so coordinating time to chat is difficult.
Yeah. We're both busy.
Yeah.
We're all busy.
And it's like, well, I can call you at 9 p.m. Yeah, and we're like, no, tonight. I need to go home and see my family. So that's just really hard. And sometimes, sending the record can just feel like very transactional, like here they came to see me, this is what we did.
Yeah.
And I think too, like to your point of getting to know the specialist in your area is really important, because I know there are some GPs who are like, I want to know what happened. Please call me. I plan on taking the case back once, things are a little bit more stable. I want to work continue to manage it with your input, which is great. And there are some who are like, out of sight, out of mind. Like, it's all you. I don't want to deal with it. And so knowing which one of those it is helpful too, because then I can say like, oh, this person, I can just shoot a text and be like, hey, Fluffy's doing great. And this person like wants to be involved. So we just need to work together. Throuple it up.
Another reason why I just wish we worked in the same place.
I know.
So I'm in Nashville and she's in basically LA, and it's
the opposite
so
side of the
far
country.
away. At least we get to see each other and like things like this. In Orlando, meet you in Orlando 3 times a year. That's what we're doing.
The happiest place on earth.
We didn't even go to Disney. Have y'all been to Epic? I was telling her I really want to go to Epic. Next time we're here, we're going to go. Harry Potter World. The new Harry Potter's coming out on HBO.
Some butterbeer.
Yeah, get some butterbeer. Okay, what? I have some questions, and you actually don't know what these questions are, but I promise they're easy. What are like some types of cases that you wish GP vets referred to you sooner? Like, can you think of a couple, like just like in general, not specific patients, but like, man, I wish GPs would send me this sooner than they typically do.
Oh, that's a great question.
I should have warned you.
I think the answer to that question is, if owners are going to be inclined to do more advanced diagnostics, I think they should just come. Let's not muck around with months and months of treatment trials first, and then have spent a bunch of time, a bunch of money, and now you're just finally coming to start to do the diagnostics. I also think specifically I'm thinking about GI disease and things like steroid trials.
Yeah.
There are some treatment trials that actually make the diagnostics I'm going to want to do a little bit more complicated to interpret, or straight up not doable. And so it's a little frustrating. Like if I want to do a scope and you've already been on pred for 3 weeks or whatever. So maybe just having an initial conversation and saying like, these are the things that are available down the line. Might that be something you want to do? If the owners are like, yeah, maybe go ahead and send them sooner.
Yeah.
If they're like, if we have to, but I really would prefer to not.
Right. If they're
then
trying
fine,
not to.
of course.
Mm-hmm.
Yeah. I think,
Yeah, that's frustrating for me to see just as like GP to GP. Like if I see a patient, even for like a second, like I see a lot of second opinions and it's like, oh, they were willing to go do something else
mucking
so
around
long
for
ago.
so long. Yeah.
And like, I see second opinion sometimes. I'm like, hey, like I would love to help you figure this out, but like, do you want to go see a specialist?
Yeah.
Like you can talk to me about this, but I'm not a specialist. And like, I do my best. But like, do you want to like go somewhere fancy and like have a fancy doctor figure this out?
No, you got to stop saying I'm smarter than you or we're fancy. It's just different.
I know you're a good cheerleader like that. But like, do you want to go to like someone who does this?
Well, I think too, like, you know, it sucks to watch your pet not doing well. And so the longer that happens, the more like emotional component is weaved into all of it. And even if it's just a medication that's relatively inexpensive, you're still doing recheck exams. Like you feel like you're dumping money into it and there's no improvement. That's aggravating. And so then I get a family who comes in who's already kind of pissed, reasonably so, but it just makes my job a little bit harder too. So I think we can set each other up for success more and people will be like, I didn't even know this was a thing. I would have done this 2 years ago. I never was told that this was even an option. Like that sucks.
Yeah. Yeah.
And then I have to be like, I'm sorry. Well, we're here now, you know? And it's just like, it's hard to kind of gain their trust back and sort of get them back to a place where they're excited about what could happen.
And people are so like, not everyone, but there's a lot of people who just have this big picture that's negative about vet med in general right now and veterinarians. And so I would imagine that a lot of times people come to you, they're frustrated already and they're like, what's this going to cost? And it does cost more. I'm sure you experience that all the time.
Yeah. I think that's the other thing that primary care doctors could help us with. I think because they know that when they drop the price, people are not going to have a super positive reaction. It's expensive. That's reasonable. But sometimes I think because of that, they just avoid having the conversation. They're like, I'll let you be the bearer of the bad news.
Yeah.
But like,
but that's not kind.
It costs like $200 to see me. Right. And it is what it is, but that's what the specialist exam costs. So if they're not going to do any of the testing that I want to do, let's save them. They don't need to cut, you know, it's not I think there's a mentality of like, if you're not going to do diagnostics, it's a waste of my time. That's not where I'm coming from at all. It's a waste of your $200. Now, maybe the conversation we have is productive enough that you feel like you got your money's worth. But a lot of times they're like, I came all the way over here. I can't afford to do that. And now I've spent money to see a doctor and I'm no closer to being better. And I'm a little pissed at my vet for not letting me know that this was what I was walking into. So I think just like it's better to set the expectations appropriately so people feel like they're like they have the power in the situation. Here's all the information available. This is what I'm choosing to do. Not that they're being like pinballed around and it's like, oh, I don't want to deal with you.
Yeah.
So
yeah, this is a great plug for consultation-based specialty medicine.
Yes, it really, and so much of the time too, I think certainly I don't want to discredit the specialist. What we do is wonderful and important, but a lot of times it just boils down to access to equipment and diagnostics. There are plenty of things that once I get you the answer, you guys can manage. Like it's not IBD is not rocket science, you know, and it's frequent enough. So sometimes it's like, I need you to go to medicine so you can get your endoscopy, we can get the biopsies, and then I can kind of take it from here. So if you can, finding more specialists who function in that middle ground gray area, I think would do so much because twofold. One, it's going to expand access to care because people who can't afford to do the whole shebang of referral can now have access to it. And also it's going to take some of the volume out of the referral hospitals, open up appointments. You're not having to wait for 8 weeks to see medicine and the ER isn't bombarded with people trying to backdoor in to get consults. So it just like kind of would make everyone's life easier. So yes, I totally agree.
Yeah. We haven't talked about this yet, but in my practice that I'm opening, we're really looking into ways to involve specialists in consultation type assistance with our GPs where, you know, it's more accessible for me to talk to an internist and get their brain power earlier in those cases, even with owners who are never going to be able to refer physically and do maybe super expensive diagnostics. But if I can get an internist involved and compensate them appropriately for sharing their brain power with me.
Yeah.
Help prevent us from doing sometimes things that you really wish we didn't do.
Yeah.
So prevent some of those missteps, or just like, because we don't know better, and just help us like make a better plan with what's in front of us. I think, spectrum of care is a topic a lot of people in vet med are talking about, but I think some people have the wrong idea of what spectrum of care is.
Yeah.
But it's like, if we can all just be like realistic about what we can and can't do as far as like the pet owner, the vet, and we make a plan accordingly within those boundaries.
Oh, totally.
Outcomes can be so much better.
So much better. And I also like a plug for pet parents. You should never, ever feel ashamed because of something you're putting on yourself, or be in a place where the doctor you're working with is making you feel bad about what your resources are.
Yeah.
So if that happens, find a new vet. But B, it's actually exceptionally helpful to us to know what we're working with.
Yeah.
So come in the door and be like, listen, I have $1,500 total. So then, like, we don't need to waste time talking about an MRI and a this and a that. Like, that's not what we're doing. Cool.
Yeah.
Great. I want to be able to make a plan that's tailored to you, your pet, and your family. And that is only possible if everyone's just like, let's lay it on the table. Here's what we got. And the nice thing about vet med is we're all used to that. Like, we're pretty good at like making some like real miracles happen, like
I would say we're the most creative medical professionals.
Absolutely. And it's kind of fun sometimes too. You'll be like, yeah, I fixed that with a popsicle stick. You know what I mean? Like
yes,
we want to do that for you for sure. And it just like, it helps everybody. We're not wasting time. And then we don't have to come and present this $10,000 estimate and have you have to be in the position to go like, I can't do that. Like, just tell us. We'll work with it. And again, and if you're ever at a place that's like, well, out the door, find a new doctor.
Yeah, if they're making you feel bad because you can't afford something.
Gross.
You need a new
pish posh.
You need a new vet.
You're not allowed in our throuple.
Get out of here. You're uninvited to the throuple.
Yeah, we're breaking up with you.
Okay. Let's see. Any like diseases, like types of cases that you feel like in the few years you've been doing this, like have become more common? Like any trends that you see, maybe having to do with the breeds that we have? Miss Frenchy Man.
I know. I'm like, what? I don't think so.
Sure, like it's just always been the poop. It's always
been the poop. I also like have only ever practiced in big city area, so I feel like like
you're thinking about Whitney right now.
No, bless her heart.
So our friend Dr. Terrell,
this woman.
If you don't follow her, you need to follow her.
Yeah,
follow her. She's in Alabama. Follow her. Dr. Whitney Terrell. She's the co-owner of a vet practice near Florence, Alabama. I think it's right. Yeah, Florence. And listen, we
have a group text, and she
sees
it's
the
usually on
craziest
Tuesdays.
cases.
She calls them Terrell Tuesdays. They're terrible Terrell Tuesdays. And she'll just send us a screenshot of an X-ray, and we're like, "Again? Are you kidding?" Like, I mean,
Nicole's always like, "Oh God,
no!" I'm the one who works only in emergency, and I'm like, today I saw a bee sting and a bit by dog that didn't have any wounds and a puppy that ate a hair tie. And she sends this thing that's just like blood's pouring out of every orifice. And you're like, what happened? She's like, I don't know.
Yeah, that one we were like, oh, it's definitely rat poison. And she's like, it's not. It wasn't.
No. Yeah.
We're like, okay.
And then she's also like going to CrossFit on her lunch break because she's
awesome.
That amazing. But
yeah, you want to talk about a vet who has to be creative? That's Dr. Whitney Terrell. She has no idea we're going to be talking about her. She's going to love this.
I'm so spoiled. So I've only ever worked in a big city. Demographic wise, most of the time people can do a lot of things. I also work in a hospital that has like 5 different specialists, but our hospital is in a larger kind of warehouse district area that has over the years become all vets. So there's a neurologist across the street, an ophthalmologist, a Just Food for Dogs. So I'm like, ooh, this is weird. Excuse me. Yeah. Mosey on across the street. I have everything in arm's length. And I'm like, oh, I don't know what to do. I'm like, oh, my dog who's here for vomiting. Is he limping? Surgeon, please come examine. Like,
I didn't know that. Oh, it's all right there.
So literally, we watched
the Vet Row.
It's amazing. We watched the the patients that are seen through neurology and have surgery get hospitalized at my clinic overnight because they don't have techs overnight. So I call it the piglet parade because at 6 p.m. when they walk over all of their back dogs, which are all Frenchies, they walk through the parking lot because it's California. It doesn't rain. Like you can. And at 6 o'clock, like little wagons full of French bulldogs come walking.
Why have you not recorded this?
Well, because they're not my patients, so I don't want to put them on the internet.
If you're far enough away,
you won't be able to tell. It's amazing.
You have to do
and
the
usually
piglet parade.
like it's a little those little like wagons you take like to the beach and stuff with your family. And so they'll put like a piece of cardboard divider. So there's like piglet, divider, piglet, divider, piglet. And by piglet, I mean French bulldog for anyone who doesn't know me.
Okay, you have to at least send me a video of this.
I will. And so it's usually like 2 or 3 wagons, and there'll be like one dachshund, and then just Frenchie.
Dachshund,
like,
Frenchie, dachshund.
Like, Dr. Fine, the piglet parade has arrived. I'm like, yay.
That is hilarious.
It's fantastic.
That is
and
so
our
cute.
surgery suite is across the parking lot. So we'll like put the dogs on the gurney, and then we like literally roll them through the parking lot because it's California and you can do that. It's crazy, but
that is awesome.
Mm-hmm.
Speaking of piglet parade, did you see there's a new study that says that like 90
Don't tell me.
No, it's good.
Oh,
Dr. Cellini posted it. Like 92% of IVDD dogs with pain intact, with deep pain, can like get surgery. They don't have to have surgery. Medical management, it can be successful.
really?
Yeah.
That's a lot.
Yeah.
Because that's like the number I quote with surgery.
Yeah.
That's amazing.
I don't know any of the details about the study. I literally just saw the cover page.
We'll have to read it because that could be awesome.
Cellini posted it. So I'm like, oh, this is legit.
Interesting.
Mm-hmm. Yeah.
Yeah. Medical management is no joke, though. I fostered a down Frenchie once thinking like it got relinquished to me. The owners couldn't do surgery and they were making the choice between like having to say goodbye or whatever. And it was 2 nights before my internship ended, and I had almost gotten away with not taking a dog home. And then I was his name was Bruce, and he was perfect. He looked like Charlie Chaplin. Oh, I fostered him for like 6 weeks.
You fostered him,
and he was deep pain positive at night, and then when we came back in the morning to do surgery, he was deep pain negative, and he regained function. He still walks like a drunken sailor.
Yeah,
but surgery fixed him. But in the like recovery phase, I was having to like express his bladder, and he was in a little wagon. And I used to be, I think, a little cavalier about it. I was like, well, I just do cage rest. And it's not a small thing to undertake. So I definitely think it needs to be like,
medical management please don't get me wrong. I'm not saying don't do surgery in your back dog, but
But
if you can't do surgery in your back dog,
that seems like
it's
the outcomes
worth
are
trying
better than
medical management.
That's cool.
You just, I snickered because you said you're being cavalier about something. You are a cavalier.
I am a cavalier.
You were talking about something very serious, and I was like, she said cavalier. Yeah, you should have surgery if your dog has IVDD. If a surgeon
you should get insurance,
if a neurologist
so that you can have surgery.
Yeah, like shameless plug for pet insurance,
literally
from an internal medicine specialist.
I'm a Frenchie mom. I mean, if they're just do it because when they're like, this surgery is going to be $15,000, but it will probably save your dog. You want to be able to be like, go.
Yeah. Especially if you like have a breed
that's
is gonna
known to have a disastrous.
Like a Frenchie. Mm-hmm. But their insurance costs a lot too.
It was double what my Huskies was.
Yeah.
Yeah. So that's also
even other like purebred dogs.
Mm-hmm.
I wonder if Goldens are higher.
Maybe.
Do you see a lot of Goldens? You diagnose them with lymphoma and then you send them to oncology.
Oh, they come in as hemoabdomens.
Hemoabdomens.
Mm-hmm.
Yeah.
I see a ton of Goldens in ER, but it's 90% of the time.
It's hemoabdomens. Yeah. Not to talk about anything depressing. Let's talk about something fun.
Okay. And pivot.
We're going to pivot. We're going to pivot just for a few minutes because we're going to run out of time.
Ross?
Yes. Pivot. Okay. Let's talk about baby talking with dogs.
No.
So if you're new here and you don't know Dr. Nicole, she
is psychotic.
So she recently went uber viral on the social medias. So excited for her. She's going to hit 1 million followers. I don't know, any day. It's crazy on Instagram.
Potentially soon, yeah.
But because she sharing videos of what she does all the time in practice, which is what a lot of veterinarians do to a certain degree.
Yeah.
In practice, which is just be really sweet and fun with their patients.
Mm-hmm.
So baby talking with them and
baby talk and the most like off the wall unhinged cuteness aggression. If you don't know what that is, it's like that feeling like with a baby when you just want to like the desire to pinch cheeks. I don't get that with humans, but I just want to like beat the crap out of really cute dogs.
It's called
All
cuteness
this
aggression.
to be said, I don't actually want to hurt anything, but sometimes you're just like, I just want to rip your face off or like just pound your head. Oh God. So, but then it's kind of become a bit of like what the craziest, like I just try to like level up how insane the things sound because it's funny. And when you like,
and people love it.
My nurses are like, did you just, and I'm like, what?
Did you say that?
Yeah. I'm about to post a video.
Oh no.
That'll probably be out by the time this comes out.
It will. Yeah.
And I'm with a puppy and I'm like, I just want to throw you into traffic. I love you so much. And my nurse was like, Dr. Fine, enough. Like you have to
say that.
You gotta stop. And I was like, it's funny. Relax.
Oh my gosh. And you talk about mouth meat.
Oh yeah. So when you squeeze, especially like a bulldog or something that has really luscious lips, you put them together.
It's mouth meat.
Mouth meat sandwich.
Mine don't do that as well.
No. And then you just I like to chew on it. To nibble on it a little.
Okay.
And like I said, I'm unwell, but you know what? I'm in the right profession.
But pet parents love it.
Because everybody does that to their own dogs too. Yes. And like to Molly's point, I'm not like reinventing the wheel. This is not like new vet behavior. I just happen to put a tripod and point a camera at myself and stick a little.
You also happen to be very adorable.
Oh, well, thank you. But it's just like my whole goal with it was, I think, we've talked about there's a lot of distrust in vets and whatever. And it's hard. You don't see what's happening behind the scenes. Your pet gets taken into the back and then it's like this whole mystery. So I just wanted to like open the curtain a little bit. And I think that helps to build trust because so many of my comments are, oh my God, is this really what's happening? Like that makes me feel so much better that my nervous dog is actually sitting in your lap while you're doing records, not in a cage because they were sat like, and that really is the vast majority of us as a profession.
So many people comment like, if this isn't how my vet is, I don't want it.
I don't want it. Yeah, I know. And I'm like, I want to throw you into traffic. I'm like, I hope my vet says that to my puppy.
But I've been very involved with knowing that some people have not been kind to you about it. Other veterinarians have been like poo-pooed it. But we don't have to talk about that because they're silly. But I think it's because of some of that. There's been some content about that. Mm-hmm. Like other people have been like, no, like pets feel more comfortable when they hear that tone of voice because they know you're not a threat. And
I certainly think so. Mm-hmm. And like there are definitely different schools of thought and there are trainers who are like, you should talk to dogs like dogs. They're not actually comfortable. All I can say is from my personal experience, there have been plenty of pets that seem really nervous and then I love on them and then their little tail starts to wag and then they start to feel better. And I feel like they're relaxed. I feel like they're very happy to be there. And the interaction feels very positive. I think mutually, hopefully.
Mm-hmm. And it's not like you're that way with all of your patients.
No, I read the room for sure. And if you're really timid, I'm not like up in your face, like, kiss me. Mm-hmm. Or if there's a dog whose temperament I don't know, like, and of course too, like the other thing is I post a 3-minute edited down version of a 20-minute interaction. And I only post one of the 15 pets I saw that day because there are others that I'm like, hello, like examining and I'm not all, but when the puppy comes in that got stung by a bee. Bruce Ween is Bruce Ween, the wiener dog. Are you kidding me? I'm not going to eat that. Of course.
Right.
That's going in the mouth.
Yeah, exactly. Durr. Yeah. People just, whatever.
There are always different opinions. You can't please everybody. That's life in general. And, I don't know what to say about
it. It's reality. It's not like you're making it up.
It doesn't matter what you say or do. There's going to be a portion of people who are like,
yeah.
So,
100%.
Yeah, so whatever.
It's like I posted about Spectrum of Care the other day, and this lady commented, was like, I don't agree with this opinion at all. A vet killed my dog because they didn't take x-rays soon enough. And I'm like, what does that have to do? What? Are you okay?
There are people with their panties in a bunch.
Yeah. So you can't win because it's like, oh, vets are too expensive. They try to upsell you. And then, oh, they didn't upsell me soon enough. I'm just like, I can't make
damned if you're due.
people.
Yeah, for sure.
Yeah.
So in that case,
I can't make people happy.
I love what I do. My pet parents, I think, feel like a rapport with me and appreciate the way that I am with their animals. And it seems like overwhelmingly the response on the internet has also been positive. And it makes me really happy.
Yes. And it makes other people happy. Don't chew on my microphone.
It almost looks like a cute little.
And Global Pet has been like a smorgasbord of dogs.
The self-control, because a lot of them are actually service animals and a lot of them have do not pet. So I walk by and I'm just like literally twitching. I'm like, don't touch it. Don't touch it. You're not supposed to touch it. You can't.
There's been all kinds of animals too. There's a potbelly pig walking around. Did you see him?
See the pig.
There, I saw a bunny yesterday.
Cute.
I think that armadillo is here again. It was at VMX. I think it's here again.
I'm dead.
What else have I seen? There's birds. I haven't seen any pocket pets.
See, cats I tolerate. I like cats.
I'm
going to get canceled. Here. I like cats. I'm a dog person though.
Yeah.
And the exotics are cool from like a very far distance, but I don't need to like be anywhere near.
Yeah, you don't need to chew on that.
I mean, actually, they'd be cool as pets. Their bodies are so different, and like exotic vets, I feel like they're much more fragile. Exotic pets, and so I like really admire people who work with them because like you could like look at a bunny wrong, and it's like.
Yeah. Where I'm doing my locum, they see bunnies.
Really,
and they're like, "Let us teach you." I'm like, "Okay, but I'm terrified."
I'm scared. Yeah. Our friend Sydney does like all exotics.
If you don't follow Sydney, you have to follow Sydney.
Yes.
What's her handle? Dr. Sydney? Sydney, you can find her. Sydney Pocard.
Yes.
And Fauna is her vet
F-A-U-N-A,
clinic.
yeah.
F-A-U-N-A.
Mm-hmm.
And she's in California also.
She does mostly exotics or exclusively exotics.
She does small animal too.
Yeah. But
dogs
a
and cats
ton
too.
of exotics. And she posts really cute pictures of like hamsters with sunglasses on.
Yes.
And
they're so cute. Yes.
Those I would eat.
You're like,
I'm like, wait, I'm getting really excited.
Like, wait, maybe I do like this too. Yeah, you got to follow Sydney. She's great.
Mm-hmm. Yeah, that was a tangent, but yes. The smorgasbord of edible creatures inside the exhibit hall is fantastic.
Yes. Which we're about to go see some more of before we have to fly away home.
I know. And they're literal celebrities. Like there's a doodle here with 2 million followers or something.
Brody the dude. I got to meet Brody.
Oh,
I did. I saw Brody. I met Brody. First day. I was like,
did you get an autograph or a podograph? Wait, we should make that a thing.
We should make that a thing. We should like pet, like when we see patients, like, can I have your podograph?
We should do that at your clinic. Yes. Oh my God. Okay, wait. What is the like trademark? Like that
podograph.
Set it here. It's a thing.
It's ours.
It's ours now. Copyright.
That's really cute.
That is cute.
Okay, yeah, we gotta go put on real clothes. Take our pajamas off. If you want to follow Dr. Nicole, if you don't already, you definitely should. Tell them where to find you.
At Dr. Dr. NicoleFein. On
Instagram and TikTok.
And TikTok and Facebook and YouTube and
all the things.
Snail mail and whatever.
Wherever I am sometimes.
Yeah, as much as humanly possible.
Every time I post, like, I'm going to see a vet med friend, people are like, is it Dr. Nicole? I'm like, probably, yes.
We were working at booth yesterday and we joked that they had gotten us these really like nice sweaters that next time they just need to get an extra large one and sew them together and just put one sleeve on the other because we're basically like attached at the hip anyways.
They're like, okay, yeah, we'll do that next
tracks.
time.
Sounds
we'll just
good.
walk around together.
Could be a hit.
Okay, we'll have to do another episode sometime.
Yeah.
We're out of time. This has been another episode of the Dr. Molly Says podcast. You can find me at Dr. Molly Says, and you can follow the podcast, Dr. Molly Says Pod. If you're listening, you can watch on YouTube. And if you're watching, you can listen all the podcast platforms. And we will see you next week on the Dr. Molly Says podcast. Bye.